Okay, next we're gonna do a Judet hip. So I just put in a 10 by 12 cassette in portrait. We're gonna go ahead and do Libby's right hip. So I'll put my right marker in the lower outer corner. Make sure my bucky's lined up. I can adjust my collimation to 10 by 12. So when you do a Judet hip, you always take two images. You do the affected hip down and the affected hip up. So for the right hip, I would do an RPO and an LPO, always centering over the right hip because that's her affected. So we'll go ahead and start with an RPO. Use your 45-degree sponge. Get my angle liner, make sure that she has it blanket correctly. Libby looks good. I'm just gonna line up her hips and her shoulders a little bit better. Okay, so when the affected side is down, your central ray is gonna be 2 inches below as is and 2 inches medial from as is. So find as is, 2 inches below. And then I just ran out of space, so I'm gonna have to slide Libby back a little bit. Healthy as is again, 2 inches below, and then you want to go 2 inches medial. Okay, if you have a lot of light on the table, I'm okay with you compensating your central ray, or you can collimate. You just need to make sure that you're getting that entire right hip. So you should have light passing symph. You don't want to clip that area, so I'm just going to sacrifice a little bit for Libby to get some light off the table. I've got my marker on the film. I would place your GP over breast tissue. Okay, so this is the right down side. So next we have to put her right up. So that means her patient position is going to be LPO, but I'm going to be centering still over her right side. Libby, I'm going to have you lay flat on your back first because your body's already crooked. Okay. Alright, so go ahead and roll back to your left side for me. Go ahead and roll back. Put that arm over. I'm going to have you roll up a little bit more. Okay. Okay. So when we do, I need to move the camera out of the way, sorry guys. When you do the upside, you only go 2 inches down from as is. You don't have to go 2 inches medial. So I'm going to palpate as is. I'm right at that level and just go 2 inches down. I still have my right marker on the right corner of my cassette. Ask your patient to hold still. You can straighten this light out. It actually looks a bit much. There we go. There we go. I would put GP over breast tissue. Make sure you have it marked. Ask your patient to hold still and click.